Already people who need oxygen, who need hospitalization are struggling.
In the capital is now 30%, 24% yesterday. This is unprecedented. What's going on in Delhi?
Well, the numbers have gone beyond the roof. There's been an exponential increase in the numbers. If you see, a couple of weeks back, we hardly had any COVID patients, and now there are thousands getting infected every day, and there's no respite. From 15, 20,000, now 25,000, and 27,000. This will go on and on. I think the situation is getting from bad to worse. And in the coming few days, also, I don't see the numbers going down, they'll go up further. One reason for this is probably the mutant strains, which is a very, very infectious strain. If you see, buildings are getting infected, one person in one household is getting infected, leading to all the people getting infected, the staff, the maids, everybody in the house is getting infected. And look at the numbers, and it's not only in Delhi. Look all over India, all the states. Look at apart from Maharashtra, Kerala, now Karnataka. You look at Bangalore, then UP and Delhi. It's getting worse. 25, 27,000, and the healthcare system is actually getting overburdened now. And I'm afraid if the numbers go on like this, we might actually have a collapse of the system because already people who need oxygen, who need hospitalization are struggling. Now, people also have to understand the fact that you can't pick and choose your hospital. Whatever is available right now, just grab it and go there. If you need oxygen, if you need hospitalization, just don't delay because you're not getting a particular hospital. So all hospitals are well equipped. They all have the medicines. If there's a shortage at all, the government is looking at it, whether it's remdesivir, whether it's tocilizumab, whatever it is, oxygen. Things are getting ramped up. They will provide all the necessary equipment, infrastructure, whatever is needed, the supplies. And we just have to make sure that nobody who has a severe disease dies because lack of availability of a bed. Right now, the most important thing, according to me, is ramping up the infrastructure of healthcare system and getting beds, especially ICU beds. ICU beds are in huge demand, and I'm sure most of the top hospitals already are full with ICU beds. There is no place. People are actually struggling to get ICU beds. But the government is looking at it. They've increased the number of beds. They're ramping up the system. They're getting more and more these hotels, banquet halls. We're making them COVID care centers. But I'm afraid that might work, might not work. But at least they're trying. They're doing things. That is the need of the hour. Because at the way things are going, we really have to do something about it. And the solutions are this only: increase the ICU beds, stay at home. People also have to realize the fact that they have to stay at home, they have to wear a mask. It's high time now. In fact, not a mask, a double mask. Because the moment they step out, you don't know, every other person is a potential infected person, and he can give them the virus. And they might have a asymptomatic or a mild disease, but once they get it back home, they give it to their parents, grandparents, and everyone gets infected. And this particular strain seems to be very, very infectious. You can see the way the numbers are going up, exponential increase in the numbers, and every day they're doubling almost. And there seems to be no respite.
First, let's talk about the beds. You know what went wrong? We had one whole year to prepare for this. We had one whole year to get our health infrastructure in place, and we seemed to be on the right track. And suddenly, everything went, all over the place.
Well, I think that's how the virus is. It evolves over time, and mutations do happen. And if such mutations happen where the virus becomes infectious, it can create havoc. And see, look, it's not only India; it has happened all over the world. If you look at the developed countries, if you look at UK, you look at US, and Italy, Germany, France, it has happened everywhere. Their healthcare system, in fact, collapsed in the first wave only a year back. They didn't have beds. They had to decide whom to ventilate, whom not to ventilate. That's why so many elderly people died over there. So that's how the virus, it's not that we were not prepared. See, the numbers had declined. over a period of time. If you look at the last 3 months, there were hardly any patients, especially in Delhi, or for that matter, even in Bombay, there were hardly any patients, though Maharashtra, Kerala did have numbers over the months, last few months. So we were prepared, but it's just the exponential increase. If the numbers go on adding like this, what can you do? How much can you handle? Any healthcare system in the world can collapse if numbers go up like this. And it has happened overnight. It has happened from 1st to 10th April. Gradually, the numbers were increasing, and 10th April onwards, it just spiraled. It's out of control now, increasing the testing. Now you're doing 1 lakh tests a day in Delhi. I mean, that's more than enough. How much can you handle? How much can a lab handle every day? Now
True.
they're taking more samples and they're not able to give you the report. If you don't get the report within 24 hours, what's the point? You get the report after 3 days. By that time, you're already struggling. And then you don't have a bed. So all these things have to be taken into consideration. It's not just the government is doing its best. I won't say they didn't know or they were not prepared. That's how it is. All governments have been taken by surprise. Keep testing. The more you test, the more you diagnose, the more you isolate, the more you trace the contacts. And that's how you bring down the number of infected patients. And at the same time, make sure all the facilities are available, all the drugs are available, and also the vaccination. Vaccination has to go parallel because though the benefits of vaccination will come much later, which will be at least 6 months later, but at least at that point of time, we'll have enough people who have immunity against the disease. In spite of the fact that there are mutant strains, see, after vaccination also you might get infected.
Exactly.
But the severity of the disease is much lesser. The chances of you getting inside a hospital are much lesser. You might not have a severe disease. Mortality is actually very, very rare post vaccination. So, vaccinations are not foolproof. None of the vaccines in the world give you 100% protection. But the more we vaccinate, the more there are chances that they will have a lesser disease and will have less mortality. And that's numbers will go up. You can't do anything in a country of 1.3 billion people. You can't do anything.
The shortage that we are seeing in the hospitals right now, and I'm talking about Delhi hospitals, shortage of the shortage of remdesivir, for the shortage of medicines, the shortage of ICU beds, that kind of is a situation where you might be forced to stop admissions.
We are trying to ramp up the facilities, create more beds, and we've gone with whatever we've been asked to do, and we've increased the number of beds have gone up, and we are trying to cope with it as much as we can. We can't stop taking patients who are sick. We'll give them first aid. We'll give them all the care that they need. But beyond that, what can we also do if you don't have facilities? But we are trying to do. We'll make makeshift arrangements for them. We'll do whatever it takes. We don't send patients back. Whenever we get any sick patients, we make sure that he's at least stable. Even if there's no bed, we have to give him first aid. We have to make sure that he's stabilized enough. And even if he gets a bed elsewhere, then he can move and he can get an ambulance. But you can't stop admissions. See, healthcare is something where you don't do this. You don't have the heart to do that. You
Yeah,
don't
but
have a
then
bed, but you give them
there is a
care.
there is a situation where there are no ICU beds available and a patient
That's what I'm saying. So
needs
you have
care.
to, what can you do? If you don't have it, you don't have it. But
Seriously.
then you have it in the other hospitals. Now, if you look at the app, at the Delhi Corona app, you still have beds. It's just that people don't want to go to those hospitals. They just want to go to the top hospitals, private or government. They just want to be in the, and that's not possible. You can't pick and choose your hospital. Whatever is available, grab it. It's not that private hospitals or top hospitals are giving some different version of remdesivir and private hospitals are not. I mean, government hospitals are not. I mean, whatever it is, we have to be practical. There's no bed. Go to the other hospital where a bed is available. Private, government, doesn't matter. It's well equipped. All the infrastructure is there. The doctors know what they're doing. We're well experienced enough now. And that's you have to be practical. I told you in the beginning also, don't pick and choose hospitals. If some hospital, whichever hospital it is full, it's full. What can you do? They will give you first aid. They'll stabilize you. They'll keep you in the emergency. They'll give you a makeshift room. But if there's no ventilator, there's no ventilator. They can't create it out of thin air. So you have to look around, you have to talk to people. There are helplines from the government. You have to call those numbers. They will come pick you up. If you're at home, they'll make sure that you get a bed somewhere. I know all this is easier said than done, but that's how it is. That's how you deal with it. If you don't have a bed, you have to call people. You have to come, call friends, family, call these helplines, make sure that somehow the patient gets into a hospital, whichever one, private, government, doesn't really matter.